Good evening, Florida, and to everyone watching across the United States. We interrupt your regular programming for a breaking news update that could change the lives of thousands, possibly millions, of seniors across the Sunshine State. I'm Sarah Thompson, and tonight we're bringing you.
In a stunning announcement just hours ago, federal officials have approved a new set of Medicare benefits specifically for Florida seniors, including, for the first time ever, completely free dental, vision, and grocery assistance for qualifying residents. Yes, you heard that right. Free dental, free eye care, and even grocery help. It's a move being described as one of the most significant expansions of senior benefits in recent history. But behind the applause, there's also confusion. And even a bit of controversy. Because while the news sounds incredible, there are still questions about who qualifies, how fast it will roll out, and whether Florida could become the testing ground for a new kind of Medicare model that may, or may not, expand nationwide. So tonight, we're digging deeper. What's really happening behind this announcement? Who stands to benefit immediately? And is there a hidden twist that could affect how seniors receive care in 2025 and beyond? Stay with us.
Earlier today, just before noon, Health and Human Services officials confirmed that the Medicare Plus 2025 initiative, a new pilot program, has been officially approved for launch in Florida starting January next year. According to preliminary documents, the plan will cover dental
and even grocery deliveries for seniors over 65 who meet income or medical need thresholds. It's being hailed as a lifeline for seniors living on fixed incomes. And in a state like Florida, where nearly 1 in 5 residents is over the age of 65, this could be a game changer. But here's where things get even more interesting, and frankly, a bit mysterious. Because officials didn't just announce the benefits, they revealed that Florida was handpicked as the first state to roll out this model. Why Florida? Why now? And what might this mean for seniors in other parts of the country? According to policy insiders, this move may be tied to Florida's rapid growth in senior population, but also to political dynamics heading into the 2025 legislative season. Some analysts believe this expansion could be part of a broader effort to test new ways of combining healthcare and basic needs, something that's never been done at this scale. For seniors, though, the news feels like a long-awaited.
I haven't had my teeth checked in 5 years. If this is real, it means I can finally smile again.
The grocery part, that's the big one. Prices are so high, I sometimes skip meals.
This could help me eat healthy again. And that's the human side of this story. The reason this program is getting so much national attention tonight, but not everyone is celebrating. Behind closed doors, there's tension and growing skepticism among some lawmakers and healthcare providers. A leaked memo from within the Centers for Medicare and Medicaid Services, obtained by local reporters, suggests that the rollout might face funding constraints if participation exceeds expectations. In plain English, there's a chance that too many people applying could temporarily overwhelm the system. Experts warn that while the benefits sound generous, Florida's healthcare infrastructure will need rapid expansion to handle new dental and vision appointments, especially in rural counties where clinics are already stretched thin. Still, the state government insists it's ready. Governor DeSantis' office released a brief statement saying, Florida welcomes this expansion and is prepared to ensure smooth access for every eligible senior. But what's quietly raising eyebrows is how the federal program will determine eligibility for the grocery component. Officials describe it as a supplemental food assistance option, not a replacement for SNAP or EBT, meaning seniors could qualify for both. That's significant because it could effectively double food support for many low-income retirees, a first in U.S. history. And yet here's the part that's got analysts talking late into the night. Sources close to the administration claim that Florida is being used as a test lab, a proving ground to see if a combined healthcare and nutrition model can reduce hospital visits and emergency costs. If it works, the model could expand to other states by late 2025. If it fails, it could quietly disappear, leaving Florida seniors as the first and only group to ever experience it. That uncertainty has added a layer of suspense to this story, because while officials celebrate the new benefits, some insiders worry that what's being tested isn't just a healthcare program, it's a new version of Medicare itself, a version that could one day blend medical, dental, vision, and nutrition into a single care package, changing the system forever. Meanwhile, across Florida tonight, senior hotlines are lighting up. Medicare offices report record call volumes from people asking when and how to sign up. But officials urge patience, saying applications will open only after formal guidance is issued, likely in early February 2025. Until then, seniors are being advised to beware of scams, as experts warn that fake sign-up calls are already targeting retirees. The Florida Attorney General's office has issued an alert warning that no one should pay or give bank information to anyone claiming early access to the new Medicare Plus benefits. Still, scammers are quick to exploit hope, and this announcement, as big as it is, has created plenty of that. Let's take a closer look at what the benefits actually include. According to official documents obtained by our newsroom, the Medicare Plus 2025 package covers 2 free dental cleanings per year, coverage for major dental procedures including fillings, dentures, and implants, up to set limits, free annual eye exams and glasses, home grocery deliveries of fresh produce, bread, and essentials for qualified low-income seniors, and optional wellness checks, including blood pressure and diabetes monitoring. That last one, grocery delivery, is perhaps the most surprising. It's being run in partnership with several national grocery chains, including Publix and Walmart, both of which are expected to participate in pilot deliveries by mid-2025. This kind of public-private collaboration is rare, and it hints at how serious the government is about tackling food insecurity among seniors. But let's pause for a moment, because buried in the details of this story lies something even more intriguing. In internal documents reviewed by analysts, there's mention of a WellCare score system, which will reportedly track seniors' overall health, nutrition, and preventive visits. The higher your score, the more benefits you may retain or expand. Critics argue this could eventually lead to a health credit model, rewarding those who follow preventive care routines and cutting back on those who don't. That's raising ethical questions, and some fear it could create a divide between seniors who are able to stay active and those who, for health reasons, cannot. Still, for now, officials emphasize that no such scoring will affect eligibility in 2025, calling it a data collection phase only. Meanwhile, in Washington, political reactions are pouring in. Supporters of the initiative, mostly from both Florida parties, are praising it as smart policy with heart. They argue that investing in seniors' well-being will reduce long-term healthcare costs, but critics say the timing is strategic, pointing out that Florida is a key electoral state and that the rollout conveniently aligns with next year's policy debates over Medicare funding. One senator commented off-camera, "It's great for seniors, yes, but it's also great politics." Still, regardless of motives, the impact on real lives is undeniable. At a senior center in Clearwater, volunteers described the moment the news broke. One man reportedly stood up and shouted, "They finally remembered us." Another began clapping, soon joined by dozens of others. Tears, laughter, disbelief, it was all there. These are the moments that remind us why stories like this matter. Behind every policy and press release are people, ordinary Floridians, who've worked hard their entire lives, now struggling with rising costs and limited benefits. And for them, this announcement isn't just a policy shift, it's hope. But make no mistake, the rollout won't be simple. Healthcare analysts predict a surge in demand that could strain local clinics especially. Dental offices. Many are already scrambling to expand capacity, with new hiring waves expected through early 2025. And there's one more twist. In fine print, the program's funding is marked as temporary appropriations, meaning Congress must renew or expand it by late 2026 to keep it alive. So while seniors can celebrate now, the long-term survival of these benefits may depend on future political decisions. Still, for now, the program stands as one of the biggest federal commitments to senior health in decades. In the coming weeks, expect to see new commercials, mailers, and public service announcements explaining eligibility and application procedures. Officials say every eligible senior will receive an official letter by mid-January outlining how to enroll, either online or through local Medicare offices. It's a historic rollout, and perhaps the beginning of something much larger, because if Florida's model succeeds, it could set the stage for a nationwide transformation of Medicare. One that doesn't just treat illness, but supports total well-being, including access to healthy food. As we close tonight's broadcast, one thought lingers. For years, Seniors across Florida have felt forgotten, squeezed by inflation, limited by insurance, and left choosing between prescriptions and groceries. Tonight, that narrative shifts. The approval of these new Medicare benefits signals not just financial relief, but a recognition, a message from policymakers that says, we see you, we hear you, and we're finally doing something about it. Of course, questions remain. Will the rollout go smoothly? Will funding hold steady? And will other states follow Florida's lead? Only time will tell. But for now, at least tonight, hope is back on the table. And for thousands of Florida seniors, that hope might just come in the form of a smile, a new pair of glasses, and a bag of fresh groceries delivered right to their door. This is Sarah Thompson reporting for Channel Update.